Well, some doctors are calling on the province to allow all adults to get a second booster of a COVID-19 vaccine this summer. Right now, a fourth dose is only available to those over age 60, as well as adults of any age who are Indigenous, living in long-term care, or immunocompromised.
Now, this means about 6 million people who had a booster last winter are still ineligible to get another shot at this point. Keep in mind, in Quebec, all adults became eligible for fourth shots in May. So for more on this, we're joined now live by Ottawa family physician, Dr. Nili Kaplan-Myrth, to talk more about this. And Dr. Kaplan-Myrth, you're taking things even to the next level here, trying to sort of effectively take the government to court over not releasing fourth doses. Why the urgency, in your opinion?
So you have to realize that most doctors and nurses and other healthcare workers are under the age of 60, and our protection from our last vaccines has waned. So you're expecting us to work in situations in which we are putting ourselves at risk, but instead of giving us a fourth dose, those doses are going in the garbage. Then extend that to all the other essential workers, all the people who are restaurant servers, who work in factories, who work as childcare providers or daycare centers or camps or schools, people who are working in grocery stores, and also to the entire population of people who want to leave their homes. So anybody who goes out and is interacting with others, we've gotten rid of the protection of masks, and the protection that was given to us through the vaccines that we've had, the first, second, and third doses, is now waning. So all that we're asking is to be eligible to have a fourth dose of that vaccine now, rather than throwing those in the garbage. There's no medical rationale for withholding the vaccine, and there is urgency because between now and the fall, we will get COVID again.
I know that you've had quite a few people at your office alone requesting the fourth booster shot. In fact, you had hundreds of people registered. Tell us a little bit more about this.
Yeah. So on June 27th, we offered to hold a booster clinic for anybody in the Ottawa area who wanted a fourth dose, and we cut it off at 730 people just because of the number of people that we could do in a day. But then Ottawa Public Health phoned us on that Friday before the clinic was supposed to run, and said that Ontario contacted them and told them that they are not allowed to let us use the vaccine. They'd rather they get thrown out than give it to the people who are high risk. And all of those essential workers and pregnant people and people with disabilities and people who are immunocompromised but don't meet the criteria according to Ontario are outraged that rather than getting the vaccine, they have to hunt for it. And Quebec is now turning people away. For a while in Ottawa, because of our proximity to Quebec, people were able to just go across to Gatineau, but Gatineau is now turning away Ontario, and people who have privilege can get in their cars and drive to the States for a fourth dose. But it shouldn't be a matter of privilege, and that's what we've said all along throughout the pandemic.
Yeah, the fact that doses are getting wasted and sort of thrown away, considering where we were just 18 months ago, that's sort of hard for, I think, a lot of people, Dr. Kaplan-Myrth, to get beyond. But even NACI is only saying, they may be recommending a fourth dose in the fall. So, that's sort of what we've turned to in many cases for guidance here. You think it should be happening now? I don't know if that's a disconnect, or how do you explain the gap between what NACI is recommending and your recommendation and urgency?
So the recommendations from NACI, I can't comment on why they came up with the decision to say that, yes, people should get fourth doses, but wait until the fall. Honestly, I think there's a lot of just laziness when it comes to not wanting to run clinics and not wanting to do the work that is required in order to actually give people vaccine. But at the same time, why shouldn't family doctors and pharmacists who are able to give the vaccine be given permission to do so? The other thing is that when we wait until the fall, then all of us who are high risk, and we're still working over the summer, we don't get the summer off, we're still working, we're still vulnerable to getting COVID. Our patients are still getting COVID. We're trying to see people in person. In hospitals are closing because they're short-staffed, and this is not going to help any of that. The number of people who end up with serious illness could further crumble our healthcare system. And then when they do open up the vaccines in the fall, no doubt, because they've said 65 and over, and maybe for people 12 and over, we're going to have to fight again about who are the vulnerable people in our population and who doesn't just have the ability to jump in a car and hunt. So I would really hope that we don't have to go to court, but we do have a legal team on standby to fight this if we need to.
Definitely something we want to be paying close attention to as well. Dr. Kaplan-Myrth, thanks for joining us this afternoon. Appreciate this.
You're welcome.